outcome of root canal treatment using warm vertical compaction with bioceramic and resin-based sealers, a randomized clinical trial that is done by a group from China led by Hugh, and it is published in the Australian Endodontic Journal in 2022. So this study aimed to compare the effect of bioceramic and resin-based sealers using warm vertical compaction on the clinical and radiographic outcomes of root canal treatment in a 2-year of follow-up. They included patients that are diagnosed with irreversible pulpitis or pulp necrosis with or without apical periodontitis who required root canal treatment. They excluded patients with immunosuppressive or systemic disease or those on medications, patients under the age of 18 years, immature teeth with open apex or root resorption, and teeth with periodontal disease and probing depth more than 4 mm. So they ended up with 76 teeth that met the inclusion criteria. Patients were randomly assigned to either of the two groups, AH plus group and iRoot group, based on a number that is randomly generated by Microsoft Excel. And after the sealer application, obturation was done using warm vertical compaction technique, and the treatment was performed by a single operator. Then patients were followed up by clinical and radiographic examination at 6, 12, and 24 months. Clinical assessment included patient-reported symptoms, tenderness to percussion or palpation, mobility, and presence of sinus tracts. Also, the preoperative, immediate post-obturation, and follow-up radiographs were evaluated by two calibrated endodontists using BAI scoring system and who were blinded to the sealer allocation. The outcome of the teeth, it was classified as success when the teeth presented asymptomatic and functional with a PAI score of 1 or 2, or failure if presented symptomatic or non-functional with a PAI score of 3, 4, or 5. Moving to the result, 61% of the included teeth were diagnosed as necrotic and 38% were diagnosed as irreversible pulpitis with or without apical periodontitis. Also, 56% were obturated with iRoot, and the other 43% were obturated with AH plus sealers. The recurrence rates of patients were 84% at 6 months, 65% at 12 months, and 48% at 24 months of follow-up. In this study, patients who missed all the 3 follow-ups were regarded as lost, while the other patients who engaged in follow-ups at least once were counted as attending. So based on this, the overall recurrence rate for the entire follow-up period, it was 88%. In the iRoot group, the success rate were 80% at 6 months, 85% at 12 and 24 months. While in the AH plus group, the success rate at 6 months was 82%, 91% at 12 months, and 88% at 24 months of follow-up. In this study, the success rate in the AH plus group, it was slightly higher than that in the iRoot group. And this is most probably because of the randomness of the case allocation rather than the sealer itself, as it is showing in this figure that the mean of preoperative areas of periapical radiolucency, it was larger in the iRoot group than in the AH plus group. However, there were no statistical significant differences between the two groups. So in conclusion, the bioceramic sealer resulted in a similar clinical performance and success rate to the resin-based sealer in endodontic treatment during 2 years of follow-up.